If a woman is on birth control pills, in my opinion, a hormone test is a waste of time and money because it is going to be totally skewed. Right. It's going to be totally skewed. So, the first question I ask in those situations, because when they're that age and they're on birth control pills, I don't like birth control pills long term anyway, because I see in my practice how often birth control pills, or not just birth control pills, but Depo-Provera shot, or Mirena IUD, anything that is hormone related to help with birth to be birth control. I see a lot of issues that it causes. My first question is like, okay, why can't she go off birth control? Then I'll say okay, so is she in a long-term relationship? Is she married? Yeah, she's married and has 2 kids. Okay, so then my next statement is, okay, she's married and has kids and she's on birth control. Why? Her husband needs a vasectomy. Why should her husband get a vasectomy?
Well, I mean, I think the biggest thing is you kind of alluded to it already, right? I mean, the long-term side effects of birth control. I mean, remember, birth controls are usually composed of hormones like estrogen, progesterone, and basically what you're doing is you're blunting the normal cycles that women usually have. You're blunting nature, and you're basically kind of delivering them a more stable level, so that way they don't cycle like they usually would. And so that's why usually at the end of these birth control packs, there's kind of a period of kind of fake pills that, basically allows the patient to cycle again and menstruate and slough off the lining and what have you. And so the reality is that, you're messing with nature right already. We know there's long-term side effects. You've already listed them for us. The reality of why a vasectomy is such a great option is because for the most part, it's pretty darn easy. I mean, yes, it takes, there is a little bit of recovery. There's probably about a 1 week period of no heavy lifting, no vigorous activity, no sexual activity. And you do have to stay out of anywhere where you're soaking your tiny little incision in water, like a bath, pool, hot tub, or what have you, until the incision heals. But otherwise, because of the fact that the testicles are external to the abdominal cavity, to the pelvis, and they're really just contained in a kind of a sac, for the lack of a better term, of skin, it makes it a very easy procedure.